Okay, this is scenario 2 of the exam, 31st September 2025. The patient presented to you with elbow pain, and your tasks are take history from the patient, ask the examiner for findings, and when you ask the examiner for findings, he will show you an image of olecranon bursitis. Then you explain the diagnosis to the patient. Okay, so when you're explaining diagnosis to the patient, you don't use jargon because you have to explain in simple terms like you're talking to a 7-year-old child. Okay, so you don't use jargon. Don't use the word olecranon bursitis. Use the word like swelling in the elbow joint and things like that. And when you take history, this is the key in this scenario, is the history. This is where doctors fail this scenario, is they don't take proper history or they don't take complete history. And in my courses and in my group coaching program, I teach a systematic and step-by-step approach where you use the ABCDE approach, OSCE Triple A traffic light formula, where you actually think in a systematic way, where you come up with a list of differentials and you rule out all the red flags. B is blunders, which is what will kill this patient with this elbow pain. C is common diagnosis. What are the common causes of elbow pain in this patient? Okay. Then D is direction, which is a mnemonic I use. Then this is what I teach in the group coaching program. Then I have a systematic and step-by-step approach. If it's a non-pain scenario, there is an approach I use. If it's a pain scenario, there's an approach I use. And this one is an ancient Greek technique where you use the traffic light methodology. And when you use this, you will have extreme success because you will not waste time, you will not miss a diagnosis. And this is what my student has used in the exam. Most likely he's going to smash all the cases because I had a chat and he is very confident in all the cases because he has this step-by-step approach. He has a systematic way of thinking, and he said the examiners were very happy. He could see that in the exam. So this is the elbow pain scenario. The key here is history. Rule out what are the blunders, what are the common diagnoses, and use the traffic light approach, and that will save you pass your exam, because nowadays it's not easy to get an exam date. So when you get an exam date, you have to go and smash the exam. You can't just take a chance and fail. So if you want to pass your exam like me or like my student, I was able to pass all my 16 stations in my first attempt. I'm starting a group coaching program launching this Sunday. So make sure you reach out and join the group coaching program, because this will be the last program for this year. And this is not like some doctor who is not even working in the Australian healthcare system teaching how to pass your exams. This is me, who has been working from 2009, who passed all my 16 cases in 2009. Since then, I've been teaching doctors and medical students. I'm an FRACGP education activity representative. I create CPD programs. I teach medical students. I teach doctors. I teach GPs for their fellowship exam. So if you would like to learn from someone like me and get it for a cheapest price, then you need to reach out and get this link to join the group training program, because I will not be taking so many students. I will only be working with limited students, because next year is when I'm going to launch it on a bigger scale, and I need some testimonials. So you promise me, if you join the group coaching program, you have to give me testimonial and feedback. So if that's the case, reach out and I will send you the link on Sunday, and I wish you all the best, and I will see you in the next scenario.